Hi guys, my name is Eric Leaf and this is my PPACA paper presentation. So my research topic was how the Affordable Care Act has affected and impacted the care for men with prostate cancer in the United States. I used 4 journal articles for the basis of my research for the paper. I got all of the articles from the Boise State Library Search Premier website. And the names of the articles were Healthcare Reform Affects Cancer on Many Fronts, the association between insurance status and prostate cancer outcomes, and the implications of the Affordable Care Act. The third one was the impact of health insurance on cancer care in disadvantaged communities. And the fourth was barriers to prostate cancer care. Affordable care is not enough. So the first article's main focus was the fact that the new reforms in the ACA will focus on eliminating the exclusion clause for patients with pre-existing conditions, and that the insurance will also be given back to patients whose insurance has been rescinded due to the fact that they had cancer in the first place. The article also talked about the financial gains of saving lives and the prevention of cancer. Some of the data that it said, it was said that a 10% reduction of in mortality rates would equate to $4.4 trillion of healthcare spending. So if they could, if we could save 10% of the people that had cancer, it would be almost a $4.5 trillion savings in healthcare spending. The next article discussed the direct relationship of if a person does or does not have insurance and the likely outcomes that will follow if the person needs cancer treatment. The article was based on a database report based on surveillance, epidemiology, and results. It's called a SEER report. The study took into account if a person was insured, where they lived, how old they were, their race, and whether or not they eventually contracted metastatic disease. The study concluded that there was a direct relationship or link between having insurance and having a favorable outcome with prostate cancer. So a person without insurance has a higher likelihood of developing metastatic disease because they don't get the quality care that they need. The next article discussed how the impact of health insurance will have on cancer care in disadvantaged communities. The article pointed out that many of those people in lower income communities have a tougher time getting the health care that they need because of the lack of insurance that they have had in the past. And the article comes to the overall conclusion that the populations with the highest level of education and the highest level of income will have much lower incidences of advanced stages of cancer because they can actually get the quality care that they need in the screening process, and then once they are diagnosed as cancer, they can get the proper care that they need to try to stop the cancer. And the last article talked about how the Affordable Care Act is basically just the tip of the iceberg when it comes to overall care for patients with prostate cancer. There needs to be better access to health education and better access to quality health care for people in lower income areas, or people living in rural areas too. And it was said that cheap insurance and healthcare can only help you so far. If the quality of care is not up to legitimate standards, then having insurance and healthcare isn't going to help as much as it would. The conclusions that I brought away from it were the fact of how important ACA is because it provides insurance to millions of people who have never had the chance to receive insurance. And these articles showed that the patients who had insurance had much higher rates of defeating cancer than before it became advanced. And overall, the topic doesn't really affect me on a professional level, just because I don't deal with cancer patients a whole lot. But the ACA will help many physicians because with so many more patients having insurance, they're obviously going to see a lot more patients, especially in the oncology side of it. The ACA will help millions of patients have that chance to actually get quality healthcare for the first time in their lives too. As we can see with the current White House administration, they're obviously trying their hardest to tear this thing apart, but I hope in the future there will still be a healthcare act that will look out for the benefit of the people.